My name is Shannon Allen. I'm a doctoral student at North Central University studying the psychology of crisis, trauma, and violence. I also have an MS from Arizona State University where I focused on complex and persistent trauma, and an MA from Liberty University where I focused on acute trauma. And it's probably relevant to add that I am the wife of a first responder, a police officer that has worked in the profession for over 20 years. It was his involvement in a mass shooting that inspired me to switch my focus to trauma, crisis, and violence. Today's presentation will address issues that many first responders face when in high stress atmospheres and often traumatizing events and crises ranging from domestic violence to mass violence, from car accidents to hostage situations, from house fires to natural disasters, from preventing a suicide to delivering a baby. And of course, those are just to name a few. And remember, it is not just the stress and trauma associated with responding to these kinds of events. Stress and trauma can be experienced by just knowing that your job requires you to face and mitigate these types of situations. As I discuss some signs and symptoms of stress and burnout, please bear in mind that the severity of an event does not dictate the severity of your physiological and psychological responses. Everyone responds differently. Psychologist Dr. Lauren Fogel wrote, "If someone else's reaction seems out of proportion to the situation, it usually means that something else was triggered." So, what may be a seemingly benign event to you may trigger memories of a similar but substantially more traumatic event for someone else. Or for some, it may be their first time responding to a particular type of traumatic event. Or some may identify in some way with the victim. For example, I've heard many first responders say things like, "That could have been my child," or "He looked just like my son," or "She reminded me of my mom." As crisis responders, the trauma you bear witness to every day undoubtedly affects you. Rachel Riemann, author and the founder of the Institute for the Study of Health and Illness, wrote, "The expectation that we can be immersed in suffering and loss daily and not be touched by it is as unrealistic as expecting to be able to walk through water without getting wet." With that in mind, the purpose of this presentation is to understand how stress and trauma affect you and what can be done about it. And with that, we're going to focus on the following objectives as we move through the presentation. First, I will cover some definitions, specifically stress, acute stress, chronic stress, traumatic stress, secondary traumatic stress, compassion fatigue, burnout, and shared trauma. Next, I want to touch on profession-specific statistics related to burnout, post-traumatic stress disorder, and suicide. After that, I'd like to get into some symptoms of stress, compassion fatigue, and burnout, including symptoms of trauma and stress-related mental disorders. Then I would like to go over some factors that may make some people more susceptible to severe and longer-lived traumatic stress symptoms. Next, I will discuss how to make yourself more resilient or better able to bounce back from traumatic experiences, and some self-care strategies. And part of self-care is knowing what to expect when responding to a traumatic incident and how to work with trauma victims. After that, I will proceed into organizational care, or how to make an organization more trauma informed and trauma sensitive in order to minimize the impact of trauma on employees. That will include a discussion on developing peer support groups. And finally, I'm going to provide some resources you can take advantage of if you find yourself experiencing signs and symptoms of stress, burnout, and so on. Stress, simply put, is a reaction to a stimulus that disrupts our mental and physical equilibrium or our internal balance. I'm sure everyone here knows what stress feels like. It's not uncommon to feel stress several times a day. Our heart starts beating fast, our breathing becomes shallow and rapid, our muscles may tense, and we can sometimes become short-tempered or irritable. Webster's dictionary defines stress as pressure exerted upon an object that can either strengthen or weaken it. So, take a paper clip for example. If you bend it open to form an S, then bend it back and forth at the joint, it will break. While aluminum is strong, it will break in half if you apply repeated stress at its weakest points. However, stress can also strengthen us. For example, stress improves our cognitive function by improving our attention span and memory, which helps us be more productive. Low doses of the stress hormone, interleukins, can strengthen your immune system. And finally, stress builds resilience. So, what is resilience? Resilience is the capacity to bounce back quickly from difficult situations. And I'll get into resilience a little more later. So, continuing with stress. Stress can be complex, and the stress curve can best explain the good, the bad, and the ugly. So, as you can see, the stress curve shows how stress impacts our performance, and in this context, performance refers to our ability to respond to a challenge, difficulty, or stressor. When we are in the green zone, we are relaxed, virtually no stress at all. And while this is a good place to be, it doesn't really prepare us to respond to stressors. The yellow zone, called eustress, is our optimum stress zone. This type of stress allows us to, say, focus on a task, take a test, conduct or give an interview, and so on. This is good stress. However, as you can see, our capacity to cope with stressors decreases as our stress levels increase. Now, let's look at what happens when we experience stress. Stress is an evolutionary, life-saving adaptation that prepares us to confront life-threatening events. When you encounter such an event, your body is flooded with stress hormones. Two that may sound familiar to you are adrenaline and cortisol. These hormones are what prepare you to fight, flee, or freeze. And these hormones are what causes your pupils to dilate, your heart to beat faster, your muscles to tighten, and your breathing to increase. This is how stress rouses your body for instantaneous and emergency action because the stress response sharpens your senses. I've heard from officers who had responded to mass shooting or active shooter incidents, and they all recall becoming laser focused on their training and objectives as if they were naturally embedded in their psyche. Unnecessary senses tend to shut down while necessary senses become more acute. This is the stress response working the way it should. Now, let's differentiate between acute stress, chronic stress, and traumatic stress. Acute stress is sudden, severe, but brief. It is typically a result of a one-time event, sometimes traumatic but not necessarily life-threatening. This could be the sudden death of a loved one, someone breaking into your house when you're not home, or even a fender bender. We typically, but not always, and I will discuss that later, recover pretty quickly from these types of incidents. Chronic stress refers to constant or frequent exposure to stressful events. Chronic stressors are generally low intensity, but tend to have a cumulative effect that is often more severe than traumatic stress because it's an inescapable exposure and repeated exposure over the life of your career. In other words, it piles up over time. Remember earlier when I discussed how just knowing that you may have to respond to a traumatic event is stressful? This is the type of day-to-day stress that you cannot escape. This is chronic stress. Some other sources of chronic stress, especially prevalent in today's environment, is a general lack of appreciation and even hate towards the helping professions. Feeling like you always have a target on your back just because you are a first responder, and increased public scrutiny and judgment. Additionally, frequent acute stressors can create high stress levels if not dealt with effectively on an ongoing basis. And as I mentioned earlier, optimal stress can strengthen your immune system. However, chronic stress can weaken it. So, chronic stress is highly pervasive. Okay, let's get into traumatic stress. A traumatic event is more than just a stressor. It refers to a life or death event, or even the perception that it is a life or death event, or an extremely distressing event that occurs outside of your ordinary experiences. As first responders, you are regularly exposed to traumatic events. However, you don't have to be directly exposed to experience traumatic stress. Witnessing an event can also have the propensity to create traumatic stress. For example, responding to a car accident that isn't necessarily a life or death situation for you, but witnessing someone else experience a life or death situation and being exposed to their injuries and their trauma and even their death can also be highly traumatizing for you. Traumatic events tend to threaten your well-being, your security, and your safety. They tend to overwhelm your capacity to cope and often result in feelings of hopelessness, intense fear, and the feeling that you have lost control. A traumatic event can ultimately change how you understand yourself, the world, and others. For example, you may come to believe that the world is generally a dangerous place, that people are dangerous and cannot be trusted, and therefore you must always be on guard. Although these view changes are not necessarily healthy, they are typical traumatic stress responses, especially among first responders. Now, let's look at what happens when you experience traumatic stress. First, it is important to note that just a single traumatic event can chronically elevate your body's stress response system. In other words, when traumatic events leave you in a state of persistent or long-term heightened alert, your body essentially overdoses itself on stress hormones. And these hormones are not intended to flow through your system at high doses for an extended period of time. So, this constant overload of hormones is highly harmful to your physical and mental health. In addition to decreasing the effectiveness of your immune system, as I mentioned earlier, it can cause chronic blood pressure and muscle tension, heart attacks, kidney disease, and even cancer. It also has an impact on your cognitive functioning, negatively affecting your attention and memory. So, as you can see, traumatic stress is not just a psychological problem, it's also a medical problem. Is trauma contagious? The answer is yes, and there are different terminologies to describe it, many you may have already heard. There's vicarious trauma, compassion fatigue, secondary traumatic stress, indirect trauma, and empathic strain. For the purpose of simplicity, let's call this type of contagion secondary traumatic stress. Secondary traumatic stress is stress experienced because of indirect exposure to traumatic events. More specifically, Charles Figley, a disaster mental health expert, explained secondary traumatic stress to be the natural consequent behaviors and emotions resulting from knowing about a traumatizing event experienced by another, the stress resulting from helping or wanting to help a traumatized or suffering person. Some examples of indirect trauma are performing life-saving measures on a car crash victim, investigating a sexual assault or a child abuse case, serving a death notification, working with trauma survivors like trauma counselors do, treating trauma victims' physical injuries, and I could certainly go on. Secondary traumatic stress can be just as harmful as direct exposure to traumatic events. In fact, in the last update of the American Psychiatric Association's diagnostic manual, they included secondary exposure as an equal risk factor for developing PTSD as direct exposure. Now, it isn't uncommon for secondary traumatic stress to result in compassion fatigue. Compassion fatigue is quite literally exhaustion from being constant witness to human suffering due to psychological trauma, pain, and injury. Figley described compassion fatigue as a combination of physical, emotional, and spiritual depletion associated with caring for people in significant emotional pain and physical distress. Burnout is a cumulative experience, like chronic stress that piles on over time. However, burnout is different from compassion fatigue because it can result from any type of stress, not just the stress of caring for and about victims of trauma. More specifically, and I will quote researchers Pine and Aronson, burnout is a state of physical, emotional, and mental exhaustion caused by long-term involvement in emotionally demanding situations. One last concept that you should be familiar with is shared trauma, or also referred to as shared traumatic reality, which refers to a community-wide traumatic event that you are not only responding to in a professional capacity, but are also coping with on personal terms. In other words, you are both responding to and are part of the traumatic event. For example, think about natural disasters. You may be helping citizens evacuate while your own home is flooding. Think about the recent Surfside condo collapse. You may be working on rescue and recovery while people you know are missing or presumed deceased. Or perhaps you have to investigate the on-duty death of one of your colleagues. Or you are the counselor at a school where a mass shooting occurred. In all of these situations, you are not just a responder, but you're a victim as well. You are experiencing the same trauma as those you are helping. Now, let's look at the prevalence of trauma and stress-related issues that first responders experience. Across all professions, on average, approximately 80% of first responders experience secondary traumatic stress, and on average, had PTSD prevalence rates of 15%. That is compared to only 4% within the general population. However, several studies have indicated that the prevalence of post-traumatic stress symptoms that cumulatively do not necessarily meet the diagnostic criteria for PTSD is much higher than 10%. 20% of police officers are on the verge of burnout at any given time, while 5% are completely burned out. And the PTSD prevalence rate among police officers is around 19%, and suicide rates are 17%. About 50% of firefighters have high levels of physical and/or emotional burnout. PTSD prevalence is around 37%, and suicide rates are approximately 18%. And suicide deaths outnumber line of duty deaths for both police officers and firefighters. Burnout rates among EMS personnel are 18%. PTSD prevalence is on average 20%, and suicide rates are 6%. Burnout rates for dispatchers are 32%. PTSD prevalence is 24%, and suicide rates are 3%. However, suicidal ideation is highest among dispatchers than other helping professions. Burnout rates are around 24% for rescue and recovery personnel. PTSD prevalence is 10%, and suicide rates are around 6%. Burnout rates among hospital workers are around 60%. PTSD prevalence is around 15%. Suicide rates among nurses are approximately 17% and 40% among doctors. And I want to point out that these numbers are pre-pandemic. I would imagine that the numbers are much higher at this point. Burnout rates among trauma counselors are 60%. And while trauma counselors can develop PTSD, their exposure is typically secondary, and therefore the rate of secondary traumatic stress is 19%, and suicide rates are around 8%. Okay, let's look at the signs and symptoms of the different types of stress. And these lists are not exhaustive, however, they are the most common responses. Acute stress symptoms are usually immediate and short term and include anxiety, irritability, concentration issues, disorientation. Like, have you ever said, I need to get my bearings? That is what disorientation is like. Argumentative, concentration, and memory problems. And some of the physiological manifestations are sweating, shivering, muscle tremors, increased heart rate, respiration, and blood pressure. But remember, acute stress events are usually singular and sudden, so symptoms typically dissipate pretty quickly. Now, recall chronic stress is a type of stress that builds up over time. So, logically, symptoms are going to last longer than acute stress symptoms. Symptoms include depression, anxiety, agitation, moodiness, irritability, anger, general unhappiness, loneliness, and isolation. And some of the physiological symptoms are achy muscles, headaches, stomach aches, lower back pain, and fatigue. Traumatic stress, remember, is the response to exposure to real or perceived life and death situations. Symptoms of traumatic stress can be short lived or long term. Often, longer term symptoms are associated with PTSD. Symptoms include self-destructive behaviors like drinking more alcohol than usual or overspending, like you may feel the need to make an exorbitant purchase like a boat or a motorcycle. Feeling numb or reversely being overcome with emotions. Flashbacks, nightmares, hypervigilant, heightened startle responses, or feeling jumpy, an inability to experience positive emotions, guilt, dissociation, which is feeling like you are in a dreamlike state or like you are detached from your feelings and your surroundings. Also, a loss of interest in enjoyable activities, withdrawal from friends, families, and coworkers, and hostility. Secondary traumatic stress can look like traumatic stress and share many of the same symptoms, so I'm not going to relist those. Instead, I'll discuss symptoms unique to secondary trauma, like being overly involved with the victims, or you may avoid the victims altogether. Feelings of powerlessness and helplessness, feeling emotionally depleted, and some of the professional manifestations of secondary traumatic stress include perfectionism or obsession with details, feeling unappreciated and undervalued, a loss of confidence, working too much, working too hard, not taking breaks, working from home, or reversely avoiding work, like showing up late or calling in sick frequently, and dissatisfaction with the job. Symptoms of compassion fatigue include physical and psychological exhaustion, ruminating about the suffering of others, anger at those who have caused suffering, self-blame, decreased sense of professional accomplishment, depression, feelings of hopelessness, helplessness, and powerlessness, cynicism, and some of the physiological symptoms include significant changes in sleep and appetite, nausea, and dizziness. And before we look at the specific symptoms of burnout, I'd like to discuss the burnout stages. The honeymoon stage is the early days and weeks of your job, right when you've just started. You're usually excited, motivated, full of energy and ambition. Although this stage is challenging because you're learning the ins and outs of your new job, you are driven and may compensate for that by working even harder. And that sets the stage for burnout because you are giving it your all at once. This is an opportune time to implement healthy coping strategies, which I will discuss later, because it is likely that your job is going to become more taxing. If you adopt healthy coping strategies during this phase, you are likely to stay more positive and adaptive and could stay in this stage indefinitely. If not, however, you will likely progress to the next stage, the balancing act. During this stage, your inner energy starts to wane. You are beginning to notice some undesirable aspects of your job. And while you are competent, some days are incredibly stressful, and your coping fluctuates between adaptive and maladaptive. For example, you may be neglecting yourself and your interpersonal needs in order to stay on top of work-related matters. The chronic stage is similar to the balancing act. However, you are just running yourself into the ground, and physiological symptoms of stress start to manifest. The crisis stage is where job-related stress starts to break you down emotionally. And without professional assistance, you are likely headed for a mental breakdown, major crisis, or the next stage, enmeshment. However, most people quit their jobs during this stage, and some even change careers. The final stage, enmeshment, is where you are so burned out that you don't even know it. Burnout has become part of your identity, and symptoms are embedded in your day-to-day functioning and leave you rather miserable with your job and even your home life. Now, let's get back to specific burnout symptoms. These symptoms are generally associated with the balancing act stage, and they include job dissatisfaction, work inefficiency, work avoidance, health risk behaviors like over or under eating, drinking, smoking, and physical and psychological exhaustion. Symptoms associated with the chronic stage involve chronic physical and psychological exhaustion, frequent physical illnesses because of immune system suppression, anger, and depression. Symptoms related to the crisis stage include emptiness, anxiety, and depressive disorders, obsession with work issues, and cynicism. Symptoms associated with enmeshment are feeling numb and apathetic. And before moving on, I want to say one more thing about burnout. Burnout typically cannot be resolved in the short term, like over a long weekend or a week-long vacation. When a first responder is genuinely burned out, they have lost all compassion for themselves and those they are supposed to be helping, and it takes some time to restore that. I know this slide is busy, but I think it is important to see a side-by-side comparison of symptoms so you can distinguish between their similarities and their differences. Most people exposed to a traumatic event will recover without professional assistance or without developing a mental disorder. However, remember earlier I mentioned that first responders are over twice as likely to develop PTSD than the general public. And this is because you are regularly exposed to multiple traumas and secondary trauma. So just being a first responder is a risk factor for PTSD. While there are other trauma and stress related mental disorders, Acute stress disorder and post-traumatic stress disorder are the most common among first responders, veterans, and the general population as well. ASD and PTSD symptoms are very similar. However, the main difference is the longevity of symptoms. For ASD, symptoms can begin immediately after exposure and persist up to 1 month, whereas PTSD symptoms can also start immediately, but they last a month or longer. Symptoms are categorized into 4 clusters: intrusion, avoidance, alterations in cognition and mood, and alterations in arousal and reactivity. And symptoms must cause significant impairment in daily functioning. Intrusion symptoms involve recurrent, involuntary, and intrusive, distressing memories and dreams about the event. They also include flashbacks, where you feel and or act as if the event is happening again. Extreme and prolonged distress or physiological reactions when exposed to reminders of the event. And reminders can be internal or external. For example, internal reminders may be thoughts, emotions, or bodily sensations associated with the event. External reminders can be sensory related, like a smell, noise that reminds you of the event. Or they can also be people, places, conversations, or situations. And these are sometimes called triggers. Included in intrusion symptoms are dissociative states, and these manifest as depersonalization, derealization, and dissociative amnesia. Depersonalization is the feeling of detachment from your body and environment, as if you are outside of yourself, observing from a distance. And it often feels like time is moving very slowly. Derealization is the feeling that your surroundings are unreal, distant, distorted, or that you're in a dreamlike state. Dissociative amnesia is the inability to remember critical details about the event. Now, dissociative states are not something that persists, or in other words, they're not constant states. Instead, they come in episodes. Next, avoidance symptoms, and they are pretty much like what it sounds. They're efforts to avoid the previously mentioned internal and external triggers. The next cluster is alterations in cognition and mood, and include negative changes in how you view yourself, others, and the world. And I touched on that earlier. Alterations in cognition and mood also include a distorted interpretation of the event's cause that leads you to blame yourself. It includes persistent negative emotions like guilt, shame, fear, horror, and anger. It includes a loss of interest and participation in enjoyable activities, isolation, and the inability to experience positive emotions. And the final symptom cluster is alterations in arousal and reactivity. Alterations in arousal and reactivity involve irritability, angry outbursts like verbal or physical aggression towards objects or people, destructive and health risk behaviors, hypervigilance, exaggerated startle responses, issues concentrating, and problems sleeping, be it trouble falling asleep, staying asleep, or sleeping too much. Throughout the presentation, I've mentioned risk factors. So let me quickly explain what that is. Risk factors are factors that may make you more susceptible to more prolonged and more severe trauma reactions. As I mentioned, being a first responder and being exposed to repeated traumatic events and secondary trauma is a risk factor. Other professional risk factors include lack of effective supervision, inexperience, inadequate training, preparation, and orientation, and a lack of departmental or professional support systems and resources. Personal risk factors include personal trauma, like you could have recently been in an off-duty car accident. Your home could have been destroyed by a natural or human-made disaster, or you could have in the past suffered a severe injury or illness. Other personal risk factors involve pre-existing mental health issues or disorders, young age, inadequate personal support systems, and experiencing a traumatic loss like the sudden death of a loved one, particularly if it occurred in the last 12 months. Now, let's move on to something more positive, and that's resilience. I briefly touched on resilience earlier, but I like to go into a little more detail. The American Psychological Association defines resilience as the process of adapting well in the face of adversity, trauma, tragedy, threats, or even significant sources of stress, such as family and relationship problems, serious health problems, or workplace and financial stressors. So it means bouncing back from difficult experiences. So, how can you become more resilient? How can you tap into your inner strengths? Your responses to traumatic events exist on the continuum of adverse reactions to positive responses. Many of these positive responses come from learning from those for whom you help. Remember earlier I mentioned that the general population typically recovers quickly from traumatic events. So it stands to reason if their trauma is contagious, then so is their resilience. Secondary resilience is a transformative process that reflects the positive responses to the work you do. Likewise, and counter to compassion fatigue is compassion satisfaction. Compassion satisfaction reflects a sense of meaning in the work you do. You are a helper, a saver, a repairer, a lifeline. That isn't just what you do, but it's who you are. So use every positive outcome to motivate you and in turn protect you against the harmful effects of trauma. Secondary resilience and compassion satisfaction can give you a greater perspective and appreciation of your own challenges. It can make you more optimistic, motivated, energized, and effective. It can give you an increased sense of hope, understanding, and the belief that you can recover from trauma. And it gives you a profound sense of commitment to work and helps you find meaning in what you do. Now, probably the most essential way to become resilient is through self-care. Building resilience requires balance. It doesn't happen automatically. And self-care requires mindful intention. Now, let me quickly explain what I mean by mindful and mindfulness because it will come up again. Mindfulness is a stress reduction and relaxation type of meditation where you focus on what you are feeling in the moment without trying to interpret the meaning of those feelings. Mindfulness does not have to be a structured meditative exercise necessarily. You can practice mindfulness anywhere. For example, when I wash dishes, I like to clear my mind, look out the window, and observe the trees, the birds, the squirrels, the rabbits, and I just relax. And eventually, I barely notice that I'm doing a dreaded, tedious, and cumbersome activity, which is doing the dishes. Those mental breaks have the capacity to energize you. If you are stuck on something and can't figure it out, stop thinking about it. Take a walk, stare out the window, clear your mind, then come back to it. That is mindfulness. Now, there are 4 parts of you: biological, psychological, social, and spiritual. Taking care of each of these parts requires planning and practice. So, before establishing a self-care plan, look at each domain and note what is working and what is not. Then decide what you are willing to change. Do you have realistic expectations for yourself and others? Take an assessment like the Professional Quality of Life Scale. I've included a link to this as well as other helpful assessments in the resource handout. Evaluate your personal and professional stress load. Determine what tasks use most of your energy. Once you've done that, you are ready to construct a self-care plan. And here are some things to consider. These are some things that you can do to improve your biological health. Get adequate sleep. Take moments to relax your body. Limit caffeine and alcohol. Stay hydrated, and that means water, not coffee. Eat healthy and fresh foods. And exercise, both cardio and strength training. Here's some tips on improving your psychological health. Laugh often. Engage in enjoyable hobbies and activities. Spend time alone. Spend time alone in nature. Practice breathing and relaxation techniques. Take breaks. Celebrate your work and accomplishments. Practice mindfulness. And the Mindfulness Coach phone app is a great place to start. Identify skills that have helped you in the past best cope with trauma. Learn about perspective taking and letting go. For example, target your priorities by asking yourself some of the following questions. What about this task is important to me? Am I attached to this task in some way that I need not be? How much control do I truly have in this situation? Is my attachment to the task in line with my broader work goals? How can I create time during the workday, for example, lunch breaks, taking a walk, to get some distance from my work stress? How can I manage time during my workday to leave my work at the office so it doesn't weigh on me after hours? Now, here are some steps on improving your social health. Spend time with people you enjoy. Talk to family, friends, supervisors, and coworkers about what you're experiencing. Know that it is okay to draw boundaries and set limits. In other words, it's okay to say no. And finally, your spiritual health. And this means different things for different people. It can mean engaging in religious or worship practices, and it can also mean meditative techniques or volunteer work. Part of self-care is being prepared, knowing what to expect, and knowing what to do when encountering individuals who have just experienced a traumatic event. One of the best evidence-based models available for working with trauma victims is psychological first aid. And evidence-based simply means that it has been scientifically proven to reduce trauma symptoms, the severity of trauma symptoms, and the longevity of trauma symptoms. And you can find the manual online, and there are different versions available that should meet your needs. PFA was generally designed for large-scale events, but it is just as useful for smaller scale events like rape, domestic violence, car accidents, and others. I'm not going to go into the entire manual. That's a whole other presentation in and of itself, but I would like to touch on the objectives of PFA and leave you with some do's and don'ts when working with trauma victims. So before I get into the objectives, it's important to note that for the people you're responding to, there is a significant probability that this is not their first traumatic experience. For example, research tells us that child sex abuse victims are 3 to 5 times more likely to experience subsequent victimization in adulthood. So remember that person you encounter who you may secretly feel is having an outsized physical and emotional reaction to the situation may very well be experiencing their first, fourth, or 10th victimization. Now, on to the PFA objectives. They are contact and engagement, safety and comfort, stabilization, information gathering, practical assistance, connection with social support, information on coping, and linkage with collaborative services. So in short, your objectives are to make contact with the victims just to let them know you are available, make sure they are in a safe location, that they are calm and oriented, identify their immediate needs and address those needs, connect them with family and friends, educate them about trauma responses and coping, which can come in the form of a handout or brochure, and these can actually be found in the PFA manual. And finally, connect them with professional services if needed. Now, here are some tips on things to do and things not to do. Remember, when working with trauma victims, the goal is to reduce distress, address immediate needs, and encourage adaptive functioning. So in short, you want to stabilize. For those investigating, stabilization is crucially important before attempting to elicit details about the event or situation. Stress hormones can quite literally shut down the brain's command center, leaving victims physically unable to talk. Next, be visible and available. Sometimes just being physically present and calm is enough to help victims feel safe and able to better cope. Be prepared for victims to avoid you or to overwhelm you. Politely observe, don't intrude, and then when you do approach victims, ask simple questions about the ways you can help. Individuals appearing especially disoriented, confused, frantic, agitated, panicky, shut down, extremely angry, or irritable likely need immediate assistance. In addition to those exhibiting these behaviors, be aware of at-risk or vulnerable victims, such as children, especially those separated from their parents or caregivers, those that are injured, the medically frail, those with disabilities, pregnant women, mothers with babies or small children, those who experienced significant losses, and I'm thinking of individuals who lost their homes or pets in a disaster type situation, or those who lost a loved one. And finally, pay attention to those who may have been exposed to extreme life threats or grotesque scenes. Now, an excellent way to make initial contact with victims is to offer practical assistance like drinks, food, or blankets. Be sure to model healthy responses. Be organized, helpful, calm, courteous, patient, sensitive, and responsive. Speak slowly and in concrete terms. Give accurate and direct information. Focus on what they have done to help themselves or others. Be prepared to make referrals like to social services or mental health services. Be knowledgeable and sensitive to cultural and racial issues. Now, here are some behaviors to avoid. Don't make assumptions about what the victim is going through. And don't assume everyone exposed to the event will be traumatized. Don't use first responder jargon or speak in terms of disorders, symptoms, pathologies, or conditions. Don't talk down or patronize victims. Don't assume that all victims want to speak with you. And don't speculate or offer inaccurate information. If you don't have an answer to their question, say you don't know, but we'll try to find out. There may be times when you are coping with difficult emotions that you may come to feel guilty or incompetent, or maybe you think that you're not cut out for this work. But remember, even if you have been diligent about self-care only goes so far. Your organization plays a significant role in your well-being and resilience, and actually has an ethical duty to inform personnel about the potential adverse effects of your work and how to cope. When organizations are not sensitive to the health and well-being of their employees and the impact of trauma exposure, the results can be disastrous. Poor organizational health can lead to decreased morale, cohesion, communication, collaboration, productivity, and quality of services. It can also lead to an erosion of concentration, focus, decision making, motivation, and performance. And it can also lead to frequent staff turnover. So now I want to turn our focus to the responsibilities of the organization. And much of the information I'm going to discuss comes from a manual published by the U.S. Department of Justice, and there is a link in the resource handout. According to organizational psychology literature, the gold standard of a trauma-sensitive organization incorporates trauma coping and support in the following organizational domains: leadership and mission, management and supervision, employee empowerment and work environment, training and professional development, and staff health and wellness. The Department of Justice offers an excellent audit tool to see where your organization stands in these domains, and it offers direction towards becoming more trauma informed. And there is a link to the audit forms that I'm about to go over in the resource handout. But before I go over the forms, here are some general instructional guidelines. Employees should fill out the audit forms and in a way that they remain anonymous. If you cannot reasonably guarantee anonymity, then you are not likely to get honest answers or any answers at all. However, you can tailor the administration of the audit in a way that best fits your organizational structure, size, and needs. Once you have collected the audit forms, you need to identify and discuss gaps in your capacity to be a trauma-informed organization. Next, map and prioritize the steps you need to take, and then identify individuals who can best address these steps. Then put the plan into action. Finally, reevaluate your efforts to become more trauma informed by conducting another audit. Now, let's take a look at the area of leadership and mission. Leadership and mission refers to effective leadership, clarity, and alignment with the organization's mission. The mission, workplace values, operations, and practices should present a clear vision that models trauma sensitivity. Management and supervision should promote practices that reduce the impact of traumatic experiences. Follow up with your employees after a critical incident and open the door to discussions about trauma. Employee empowerment and work environment refers to fostering teamwork and collaboration inside and outside of the organization. Create formal and informal opportunities for your employees to connect with one another and offer opportunities to diversify their job-related tasks. Diversity of tasks is especially important in preventing burnout. Training and professional development should be effective, ongoing, and trauma-informed. In other words, train employees to identify and manage stress, overview stress reactions, offer resources within and outside of the organization, build and foster resilience, and offer stress management techniques. Staff and health wellness involves providing access to mental and physical health resources, professional development, networking opportunities, and ongoing training. And this is just a brief overview of how to create a trauma-informed atmosphere. Now, let's look at something more specific and a rather important strategy in mitigating trauma responses, and that is peer support. Critical incident stress management and critical incident stress debriefings have typically been the go-to models used by first responders in terms of peer support. However, more and more evidence is pointing to the ineffectiveness of these methods, and some research has indicated that they do more harm than good. CISM and CISD are slowly but surely starting to be replaced by psychological first aid. Now, first aid is known well by mental health professionals as a field-style immediate crisis intervention protocol for civilian trauma victims. However, it has been successfully adapted to meet the needs of first responders by making it peer-based, and is called Traumatic Incident Peer Support, or TIPS. Consistently, research underscores the critical role peer support plays in mitigating trauma responses and supporting resilience. One of the issues of CISM and CISD that has been corrected with TIPS is CISM and CISD typically require first responders to participate, and that can often exacerbate symptoms. Many people heal from just listening to the stories of like others. I recently read a quote by Dr. Breen Brown, who is a social worker and professor, that embodies this idea. It read, "You will tell your story of how you overcame what you went through, and it will be someone else's survival guide." So, unlike CISM and CISD, TIPS allows for voluntary participation. In other words, In fact, the TIPS model entails listen, protect, and connect. Now, you don't have to wait for a critical incident to gather TIPS teams. In fact, it is best to prepare in advance. Team members should be individuals within the department, or the profession who are mentally capable and respected and who have excellent interpersonal and listening skills. Team members may have had previous traumatic experiences and are interested in helping others who have experienced similar incidents. Now, I understand that during large-scale incidents, the entire department may need support. Therefore, you may want to work with other departments to construct a regional or state team. The First Responder Foundation and the First Responder Support Network are peer-driven support networks that can help you locate or organize peer support teams. However, it is still often best to have at least one organizational representative because mental health support should be an ongoing effort. In addition, ideally, peer support teams should be supervised by a qualified mental health professional familiar with first responder peer support. And of course, confidentiality respected and ensured by strict guidelines per local, state, and federal laws. One of the biggest complaints I hear from first responders is that they are uncomfortable with disclosing or sharing their thoughts and emotions for fear of being fired. However, remember, you have a legal right to confidentiality whether you're speaking to a licensed counselor or a peer support member. Nonetheless, some first responders may still be reticent to discuss mental health issues. So, the most important function of peer support teams is to educate. And this should be done regularly, not just after a critical incident. Education allows peer support teams to offer information on traumatic stress, coping, self-care, and external resources like employee assistance programs without putting first responders in a position where they fear being fired or deemed unfit for duty. Now, let's look at the components of TIPS. The first one is listen. This not only involves listening to what your peers are saying, but observing their nonverbal cues like their tone, body movements, eye contact, and so on. Often, nonverbal communications tell you more about what your coworker is dealing with than what they're actually saying. It's important to remember that peers should never be pressured, coerced, or ordered to speak. However, should you feel compelled to do so, try to find an opportunity to talk to a coworker that may be struggling. The next objective is to protect. Some simple gestures can help protect your coworkers from ongoing stress. In the field, immediately after a critical incident, if you see a peer struggling, maybe they seem lost or disoriented, or perhaps they are highly emotional, start with the basics. Bring them some water, food, or first aid if needed. Proximity is a risk factor in developing severe trauma reactions. The closer someone is, or the more involved they are in a traumatic incident, the more likely they will have more serious and longer-term reactions. Therefore, those directly involved should be removed from the scene and shielded from the media as soon as possible. They should be given time to decompress and reconcile the events and their thoughts and feelings about the event. After a significant incident involving multiple first responders, one police department's TIPS team members personnel out of the scene and facilitated surveillance for signs of distress. In the days after the event, they checked in on them, asked them to go to lunch, brought them some coffee, told them a joke. And if a coworker is injured during a critical incident, coordinate hospital or home visits with those concerned. This helps the injured and immediate family feel less overwhelmed. Finally, the third objective, connect. In the immediate aftermath of a critical incident, connect involved in the incident to support systems within and outside of the department. I'd like to go over just a couple more things about the delivery of peer support interventions. First, as I mentioned earlier, some employees may not want to share in a group setting, and so peer support team members should try to accommodate these individuals by meeting with them one-on-one or in smaller groups, like maybe just their shift. However, I know many departments offer peer support in group settings, especially after a large-scale event. So when going that route, it is important to gather individuals based on their level of exposure. For example, you may have a group of just police officers or just firefighters or EMS and so on. And then you may have a separate group of dispatchers and then another group with only support staff. And the reason why this is important is that you don't want, say, support staff who may not have had direct exposure to be secondarily traumatized by hearing about the more graphic details from those directly exposed. And last, if you are a group member or participant, please respect the privacy and confidentiality of your coworkers. In other words, don't talk about deeply personal and emotional matters discussed in the group with people outside of the group. If you are especially concerned about a group member, take it up with a peer team leader or the peer team counselor. Now, we have finally made it to the end of the presentation, and before going, I would like to leave you with some great resources. And additionally, there is a handout including these resources and more, and how to access them. Eye of the Storm provides a wealth of information for first responders on how victims respond to traumatic events, working with individuals who have suddenly lost a loved one, psychological first aid, self-care, spirituality, and there is a handout that you can give to trauma survivors. I'm sure many of you are familiar with Lieutenant Colonel Dave Grossman. The Tactical Breather app is based on the techniques described in his book on combat. This app, which is available on Google Play and Apple's App Store, helps you gain control of your psychological and physiological responses to stress, like your emotions, concentration, and heart rate. Here to Help offers a 14-question overall well-being assessment. Results are not recorded by the website, meaning it is completely private, and the results are emailed to you to whatever email address you provide. Responder Strong offers resources such as a wellness app, self-screenings, relaxation exercises, stress management, mindfulness exercises, and a needs assessment. A needs assessment helps you determine what emotional needs are being met and which ones are not being met in terms of your social connections. And remember, social support plays a huge role in trauma recovery. The website also has a feelings inventory, which is very similar to the needs inventory. And they have profession-specific resources, as well as a 24-hour confidential text-based helpline. And the resources on this site are intended for both first responders and their families. The Substance Abuse and Mental Health Services Administration offers an excellent handout for first responders that addresses stress management during a critical incident and post-incident stress management techniques. The Office for Victims of Crime, which is a part of the Department of Justice, supplies a manual on creating trauma-informed organizations. And this is where you can find the organizational audit forms that I went over earlier. In addition, their website has over 500 web-based resources that coincide with the areas of the organizational audit. So when you're developing your trauma-informed organizational plan, you can turn to these resources to find ways to improve areas where your organization may be falling short of being trauma-informed. The Centers for Disease Control and Prevention provides information on emotional and mental preparation for a critical incident, secondary trauma, burnout, how to develop a buddy system, self-care, adjusting to family, home, and regular work life after a critical incident. And the website provides an excellent handout for families that offers tips on what to expect and how to help you after a critical incident. Safe Call Now is a nationwide 24-hour confidential helpline that provides crisis referral services to first responders and their families. The National Center for PTSD website has a self-care toolkit primarily for trauma counselors, but it is also valuable for other types of first responders. It includes information on working with trauma survivors, self-assessments, self-help strategies, phone apps, and online courses. Copline is a 24-hour confidential peer support helpline operated by retired police officers, and they also accept calls from family members who need support. Share the Load program is for fire and EMS and provides resources to help you and your family overcome work and personal stress-related problems. The website offers a nationwide directory of behavioral health service providers, a blueprint to help fire and EMS organizations develop a behavioral health program, a wellness app, newsletters, courses, and webinars. BC First Responders Mental Health website offers self-screening tools, self-care techniques, mental health training courses, and materials for a poster campaign called Share It, Don't Wear It. And that's where the pictures throughout this presentation came from. These posters can be hung in your department and can list your organization's mental health resources outside of the organization, and it overall promotes wellness. The Heroes Health phone app allows you to track wellness with weekly 5-minute surveys. Organizational leaders can also customize the app with information about mental health resources within and outside the department. In addition, organizational leaders can implement employee surveys that are anonymously reported back to the organization's leaders. And this can give them a good idea about what you need and how you are doing overall. The First Responders Foundation is a resource that I mentioned earlier that provides information on peer support teams. They also offer online physical fitness programs, home safety programs, online peer support, a spousal support group, and mental health services for first responders and their families. The First Responders Support Network is another resource that I mentioned earlier that provides information on developing peer support teams. They also have a directory of mental health professionals. They offer retreats and they have books, articles, audio presentations, video presentations, and outside links to wellness information for first responders and their families. The Substance Abuse and Mental Health Services Administration offers a general population confidential 24-hour helpline that provides treatment referrals and information for individuals and families facing mental health issues. The Crisis Helpline is a 24-hour confidential text-based helpline, and they serve anyone who is experiencing a crisis, and they will put you in touch with a crisis counselor immediately, so you can immediately text back and forth with a licensed counselor. The Mindfulness Coach app was developed by the Department of Veterans Affairs and provides self-guided training to help you understand and adopt mindful practices. First Responder Resiliency offers a science-based approach to the physiological, neurological, psychological, and emotional effects of traumatic stress on first responders and their families. Programs include a brain module that covers neuroanatomy, mindfulness, and how the autonomic and central nervous system responds to traumatic stress. They have a body module that covers physical exercise and nutrition, the importance of sleep, and toxin exposures. They have a mind module that covers psychological health, cognitive behavior therapy, which is a frequently used therapeutic technique to treat traumatic stress, and emotional awareness. Their legacy module covers leadership, family health, and modality training. And finally, their disability reduction module covers post-traumatic injury, substance abuse, suicide awareness, and stress and injury reduction. Finally, the All Clear Foundation provides information on work-life balance, substance abuse, anger management, loneliness and depression, nutrition, physical health, resilience, sleep, stress and anxiety, suicidality, trauma, burnout, mindfulness and balance, stigma, relationships, LGBTQ+ issues, crisis support, purpose and identity, grief and loss, and trauma support. Thank you so much for your time, and especially for your selfless service to our communities. Please feel free to contact me if you have any questions or concerns.